my name is Danielle, and today I'll be demonstrating how to complete a sterile wound dressing change. First, I would enter my patient's room. Hello, my name is Danielle. I'm going to be your nurse today. And what is your name and date of birth? Perfect. So today I'm just going to be changing your dressing on your wound and placing new dressing on top, and at that time I'll also be inspecting and making sure there's nothing abnormal going on. So I'm going to go ahead and provide us with some privacy, and I would perform some hand hygiene. Okay. Are you in any pain today on a 0 to 10 scale? No? Alright, so I'm going to go ahead and position you. I'm going to lay you flat. Just let me know if you're uncomfortable at all. Okay, and that's okay? Alright, so I'm going to go ahead and just expose you here, leaving you with some privacy. And we're going to go ahead and just take that old dressing off. So I'm just going to don some clean gloves. Okay. So what I'm going to do is I'm going to remove my patient's old dressing, and I'm going to make sure that I keep the skin in place because I want that to stay intact and not form skin tears from the tape. So I'm going to hold the skin down and remove the dressing. Okay. And at this point, I would also check for drainage, the amount of drainage, color, any smell, and make sure that I document everything, especially any abnormal findings. And I would get rid of that. And I would do the same with the other dressings. Take these gauze pads off, get rid of those. Again, just noting and documenting everything. And I would go ahead and remove this old dressing as well. Again, just making sure to be aware of any abnormal findings. Now I'm going to go ahead and just inspect the area. So I'm going to go ahead and palpate for any bogginess. Just let me know if you're in any pain at all. Okay. And I would just, again, note everything. The color, if the patient is in any pain, severe pain, anything like that. Next, I'm going to go ahead and I'm going to measure the length, the width, and the depth of my patient's wound. So I'm going to go ahead and take these cotton tip swabs here. Get those open, and I'm going to first measure the length of my patient's wound, and I'm going to go from the furthest areas, and this here is done in centimeters. Making sure not to touch the wound, I can see that my patient's wound is 14 centimeters in length, 3 centimeters in width, and now I'm going to go ahead and check the depth of the wound. So I'll go ahead and leave that open. Take a sterile cotton swab, and making sure not to touch the wound, I would just, and from where my fingertip is to the end of the swab is the depth of the wound, and I would measure it against my tape measure, and it looks like it's 4 centimeters in depth. So just make sure to note all of that, and I would get this out of here so I have more room. Okay. So again, I got the length, the width, and the depth of the wound. So I'm going to go ahead and just remove these gloves and just let my patient know that now we're going to begin the process of putting on the new dressing. Go ahead and just perform some hand hygiene. And again, I'm just explaining to my patient everything step by step so they are aware. Okay, now I'm going to go ahead and open up my sterile package. And I'm just going to fold it under there. Move that to the side. Yeah. I'm going to go ahead and open up my drape. This is going to be for all my sterile supplies to go on. Making sure that it does not touch anything and that my fingers do not go over the 1-inch border. And just lay that down. Next, I'm going to dump my contents on top of the sterile field, making sure that my box does not touch the sterile field, and put that to the side. Now, before I don my sterile gloves, I'm going to go ahead and put the sterile water into the container, which is going to be used to soak the swabs. So here I can see that this is a new bottle. If it was an old bottle, I would make sure that I check expiration, and I would go ahead and lip it to get anything off that may be on the lid. But this is a new bottle, this is the correct solution that I need, and it is not expired. So go ahead and just open the bottle and into my container. And I would also get rid of this just so I have more room for my sterile area. Okay, so that is all set. Next I'm going to don my sterile gloves. So using the 1-inch border, I'm just going to move that to the side, and I'm going to grab my sterile gloves. Okay. So I'm going to go underneath the cuffs and open up the gloves here, still being aware of the 1-inch border on my sterile field. And I'm going to don my dominant hand first. So I'm going to go ahead and just reach under the cuff here and don this hand first. Okay. Then I'm going to do the cuff here and don my other hand. And then I can go ahead and position my gloves comfortably on my hand now that they are both sterile. Okay, now I'm going to make sure that my hands do not fall below my waist, and I'm going to go ahead and discard this into the trash receptacle. And now I'm ready to begin my dressing change. So I'm just going to move this over. Okay, so I'm first just going to prepare my supplies for the dressing change. So that includes taking the 3 gauze and dropping them into the solution. 1, 2, and this gauze here will be laid on top. Okay. Open up my ABD pad, being aware of the 1-inch border. Opening up my swab so I can go ahead and clean the wound. Okay, now I'll begin the wound dressing change. I'm first going to start with my swabs here. And I'm going to clean from top to bottom. Okay. And discard. And discard, and lastly the center, and discard. Okay, now that my patient's wound is clean, I'm going to pack the wound. So what I'm going to do here is I'm going to keep my dominant hand sterile, and this hand is going to get wet, so that will no longer be sterile, it will just be hospital clean. So I'm going to go ahead and take my sterile forceps. I'm going to grab the gauze and rinse off with this hand. Okay. I'm now going to go ahead and pack my wound. And what I want to do here too is leave a little tail so it's easier for the removal. Okay. Process. Do the same thing again, making sure that I leave that tail there and making sure not to touch any of the wound. Okay, so again, this is hospital clean and this is still sterile. I'm just going to discard my forceps. Okay, now I'm going to place the gauze pad on top and just lay it there. And also with my ABD pad with the blue line facing up. Okay, and I already prepared my tape with the date and top of the wound dressing there. And then I would go ahead and I would tape my wound. On all 4 of the edges here. Just making sure that all 4 of the edges are completely taped. and my label is on there with the date, time, and my initials. I would go ahead and just discard of everything. Going to remove my gloves here. And now I'm just going to get my patient back in a comfortable position. Have him regain his privacy. Go ahead and put the rail back up that I did take down. Just going to lay you up, okay? Make sure that my patient's call light is in reach. And again, I would then go and document my procedure. Thank you.